It's a saying. Okay, good morning, everyone. It is 9:05 a.m. and we are here Tuesday, September 2nd at our work session here at the Government Center. If you'll please stand and join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okie dokie. The first thing we do have, and here comes beautiful presentations. No worries. Thank you, guys. Woohoo! First up is a presentation on our proposed MOU between Doña County and the Village of Hatch for fire services. And what's up, Chief? It's kind of cool. Maybe I should be a football player or something.
Morning, Mr. Chair, Commissioners. Morning. Andy Bowen, Interim Fire Chief. I believe you have a presentation in front of you. Okay.
We'll follow along on this. We'll follow along on paper.
But you have this one. That'd be great. Thank you. So what I'm presenting to you all today is a proposal to enter into an MOU with the Village of Hatch for Doña County Fire Rescue to provide fire and EMS services to the village. So if you flip over to page 2, it's the partnership overview. This proposal would include the Village of Hatch deeding their current fire station. There's also a property behind the fire station that they also own. They would deed those properties over to the county. They would also transfer the current apparatus and all firefighting equipment to the county. And in return, the county would staff one engine or rescue vehicle in the Village of Hatch. What that would do for us, I believe it's on the next page if you look at that north area map. What that does for the county is it takes our current career station is in Rincon. That station in Rincon has to respond not only to Hatch, but they also have to respond to Highway 26. They also have to respond all the way to Garfield. And those response times are not good. I'll show that to you here in just a second. But if what you can see from the map, if we centrally locate a career station in Hatch, New Mexico, that puts us right in the center of that northern area. That's that red box on that map in front of you. If you look at the station 31 in Rincon and station 33 in Garfield, it's directly in the middle of those two stations. So it would really centrally locate our resources. So the next two pictures are of the fire station there in Hatch. The station would need some renovation, or a new station would need to be built at some point. And then if you look, the next slide is of the house that's behind the fire station. That's also owned by the village and would be deeded over to the county. On page 7, you'll see that the benefits to the county would, like I mentioned before, it would centrally locate the resources up there. It would enhance the services not only to the Village of Hatch, but also to the residents in the northern part of Doña County. It would strengthen our response up there. So our initial move right now would to be put one engine in Hatch and leave a rescue in Rincon. So that would separate our resources and we would have redundant resources. In Hatch, we would also station a rescue vehicle so that engine company, if they got an EMS call and they need to transport with the transfer of the EMS transport service going to fire-based EMS, that would allow them to transport and there would still be a rescue in the area. And it would reduce the response times to Garfield. So if you look at the box there on the top right, Our average response time right now to Garfield is 31 minutes from Rincon. To Hatch, it's 17 minutes from Rincon. So by putting that resource there in Hatch, we more than cut that response time in half. So that will really benefit the residents further north. The reason we put that Radium Springs response time in there is we really wanted to point out that the response time from the Doña station is much less to Radium Springs than it is from Rincon. So we do understand that at times that station goes to assist in the Radium Springs area, but the response time's half of that coming out of Doña. So Doña is really the closer station.
Mr. Chairman?
Go ahead, Commissioner.
Thank you. Intern Chief Bowen, just for clarity, the times that we're seeing here are specific to the Rincon station only.
Yes, this is the current response times for
Okay.
Rincon Station.
I just
Yes,
wanted
sir.
to make sure, so that way, just for when we're looking at it, we know we're not looking at the.
Yes, sir, I
you know,
apologize for that.
overall response times just out of the one station. Thank you.
Yes, sir. These are current response times. If we did enter into an MOU with Hatch, like I said, those times would be cut in half. And
Commissioner. Yeah. Because they're still recording, they just don't.
All right, great. What happened, now they already have personnel there, right, running the stations? And Hatch has their own fire department. Are we gonna get them or not?
so they currently have volunteers in Hatch.
Okay.
What we would do is we would offer those volunteers to become part of Doña County Fire Rescue as volunteers.
Okay.
We would really appreciate their support. They have asked if we could do like an exchange where they covered in the evening hours and we covered during the daytime. But they don't currently provide EMS services. So with that lack of EMS, we would really need to have a career staff there the whole time. But we really would lean on those volunteers. We're very hopeful that they would volunteer with us in that same area. Because when that engine responds, that means that station's empty. So if volunteers could assist with that, if they could assist with the staffing on the engine, that would really help us out a lot.
Okay, the residence is associated with the property. Is that what,
Yes,
I
sir.
want to say, is that currently being used?
No, sir, it's vacant right now.
Okay, so if we did decide to put full-time staff up there, I mean, we have most of the facilities with the property, if I understand it correctly. Is that right? I mean, we
Yes,
have a
sir.
house.
The property would be deeded to the county.
Right,
That would be the easiest way for us to maintain that property and have control over that property since it's being utilized by the county.
we're having the house there already. We don't have to build out the station to take 24 by 7 by 24 if we decide to staff it permanently.
We're unclear on the condition of the house, Commissioner Reynolds. So we have been told two different things. One is that it's in very poor condition. The other is that it's in decent condition. One of the ideas that we've been exploring is if it is in poor condition, we could have that house removed and bring the single wide trailer that's currently at the Anthony Station, move it there to Hatch for the firefighters.
Right, right. I mean, I'm just saying that we have some property there, and so the expansion of the facility shouldn't cost us a lot of money to be able
That's
to make
correct,
it
sir.
a full-time station for us. That's all I'm saying.
That's correct, sir.
Cool. Anything else, commissioners?
No, I just, Mr. Chairman, I just want to at least point out, and I think part of it is that I think already right now, Doña County responds to a majority of the calls to the Hatch area, and I think if, given the situation, the overtures by the village of Hatch, I think are appropriate, and I think I appreciate the fact that at least in some ways, while they might struggle just like we do with the city of Anthony for funding, the ability to at least have some assets that would come over to us for us to utilize is a nice, at least a nice gesture that really puts us at the ability of serving out of the Village Hatch, as the interim chief noted, and the other part is I believe, we would be able to access the state funding for responding to the village of Hatch. So I think this, as the interim chief points out, I think in the end, benefit the residents in the Hatch Valley. And I know these are particularly my constituents, but I appreciate the suggestion by interim chief.
Thank you.
I have one more question. So with this, if we take the property, take responsibility, will Hatch still be responsible for paying us something for service?
So the proposed MOU right now is that Hatch would sign over their state fire funds to the county. So that funding that they currently receive would be transferred to the county.
Okay, is that an ongoing yearly fund that we get to keep getting?
Yes, sir,
Is it enough
Commissioner.
to cover our costs if there's money in there?
Yes, sir. So that would cover equipment, fuel, repairs on apparatus.
All right, so we don't have to have an agreement where the village of Hatch actually pays us more money other than this fund. So we're good there.
No, sir, not at this time. We're not proposing that. We're just proposing that they transfer their state fire funds. One thing that we do anticipate is with making that a career station, we do expect that next time they do an ISO evaluation, their number would go down and the funding would increase.
Okay, all right, sounds great.
Thank you for the question.
Okay. Anything else?
That's all I got.
This will be on our next week for review or consideration, right? Okay, thank you.
Okay. Has Hatch started the process as well on their side?
I believe they've talked about it informally, and I believe the plan is that they would present a resolution similar to the one that you will see next week, that they will do that on that same evening on September 9th.
Awesome.
Yeah, I think that was kind of the timing we had. I have not had the discussion specifically with the village of Hatch,
Right.
but I know in discussing with interim chief Bowen the hope was that we would be able to review the MOU the morning of the 9th, and then the evening of the 9th, the Hatch village trustees meet, and they should be able to approve it then as well.
And Mr. Chair, one of the things that makes this time sensitive is the transfer to fire-based EMS on September 21st. We have received word from AMR that they will be vacating Hatch on that day. So that really puts the burden upon Doña County Fire Rescue to provide those transport services. So that's one of the reasons that we're trying to get this before you as soon as possible.
Cool. Let's do it.
All right. Thank you.
Thank you, sir.
I'm sorry, I have one more question. I forgot.
Yes, sir.
Are any of the volunteers at the Hatch actually EMT 1s, 2s, or paramedics?
I believe of the current volunteers that I'm aware of, I believe one is an EMT. And that may be two, because one of our career staff also volunteers in Hatch, but not that many. One of the things we did notice is when we did a tour of their station, they showed us the apparatus. They have no EMS equipment on any of their apparatus. So we did observe that. Thank you.
All right, thank you.
And I just want to, and I'm sorry to put this, and I think just for us commissioners, and it may, if it ever comes up, one of the things that I know interim chief had noted was I know we were looking at the response times to Radium Springs, and part of the reason we had looked at, doing it, or he suggested looking at Hatch or putting one unit at Hatch was actually the Fair Acres, if I understood it right, the Fair Acres station being opened up full time. So then that way, the Doña station is not pulled as much into or west of the city versus, and they, like they had been, and then they're able to respond up north a lot more. So that station in your district, Chairman, seems to help in terms of the need for response out of Station 1.
Awesome.
Yes, sir, Commissioner Sanchez, that is correct.
Cool. We love that.
Thank you.
Thank you.
Okay, moving on, we do have a conversation about the opioid settlement expenditure recommendations.
Good morning, Commissioners. Jamie Michael,
Morning.
County's Health and Human Services Department. You do have the full presentation from the meeting last week, but I was going to focus on the last couple of slides that talk about next steps. But if you have questions on any part of the presentation, I'm happy to address those. So if you look at slide number 17, the first slide titled Next Steps, that is a bulleted list of the next steps.
What does the title look like? Because our slides aren't numbered.
There's two that say next steps. So it's the first of the next steps
Oh, okay.
ones. And it is third from the end. You are correct.
Development of RFPs.
Development of RFPs, correct. So that is where we are now. With the approval of the resolution, we have some directions. So now we can create the scope of work for the RFP. We can also allocate other funding outside of the RFP process if necessary. And we are hoping that we have our first meeting about that this afternoon. So the timeline is by middle of October, we're hoping to have the RFP completed and ready to be released. I also just wanted to give you all a heads up that we are presenting to the Legislative Health and Human Services Committee. They reached out and wanted to know what the city and the county were doing with their opioid funds. So I'm going to give them the same information that you all received. The highlight is that pre-proposal community workshop. So on September 16th, we're hosting a workshop. Anyone interested in applying for funds, we're inviting them to join us to learn about the process, and that is already calendared and save the dates have gone out. And then again, releasing the RFPs, we want to keep them open for a significant amount of time, at least 30 days, and then we'll have an evaluation process that will be both city and county. We're both trying to follow that same timeline. And ideally, we would bring the contracts to you all for approval and award at the first meeting in January. So the next slide just gives a little more detail about a few of those steps. The RFP is what we're doing. The city is going to do a different process because they do grants, so they may do a request for an application, but they'll be separate, a document that is released from the city and a document that is released from the county, but they'll be very coordinated. We will have the same criteria and evaluation panel, so the same group of 5 people will read all of the proposals, evaluate them, and make recommendations, looking at it as a collective program instead of individual contracts. We are encouraging providers to do collaborative proposals because we want to see new and expanded services. We don't want to just fund what is currently happening within the area. And the specifications within the RFP will specify what we want to accomplish, so the overarching objectives for the services. We can also specify the population that should be served, the location, and the criteria of the capacity for the providers. The pre-proposal community workshop, we're going to use that time to set the expectations, some of the same information, talking about collaborative proposals, talking about new and enhanced services. We also are going to use that, I think it's like 6 hours. We have guest speakers coming in because we want to provide the local providers examples of best practice programs. We want to give them local resources, national resources that will help them put together their proposal and just demonstrate that there are model programs out there and there are resources that they can rely on. Some of the experts are coming from UNM. They host the opioid hub for the state, and they do ongoing education for providers about medication-assisted treatment, about peer support. They have several different programs, so we've invited some of those folks, again, to come down and share those resources so the local providers have resources and people they can contact. Some other investments, not everything will be done through that one RFP process. We do have current staff that is funded under state and federal funds that are not going to be indefinite, and that position does the majority of the overdose education. We also purchase Narcan, and we distribute Narcan to community members, to first responders, so some of the funds will be used for county staff to continue to distribute that Narcan. And then we have some current contractors that are doing similar work. Specifically, under that, we have 2 contracts that are supporting the transitional housing project across the street, and these funds can be used to expand their current contract and allow them to serve the people who will be living in that transitional supportive housing. That's the information I have, but I'm happy to answer questions.
Thank you. Commissioners, questions?
I have a couple.
Yeah, go ahead, Commissioner.
Do you have an estimate of how many people in the county need to be served for this? I mean, are we talking, 500? We talking 5,000? We talking 50,000? I mean, are you having any kind of estimate of how big this problem is?
Commissioner Reynolds, we have overdose data, so we can tell you approximately how many overdoses, and of those, how many were fatal. We also, I saw some data from the state that described how many people within Medicaid have a diagnosis of an opioid use disorder, how many are receiving treatment, and then the gap of how many have the diagnosis and are not receiving treatment. So we have some data that indicates the number of people that may need the service, but we are focusing on treatment and prevention. And when we look at prevention, I would say everyone needs the prevention treatment, because I think the opioid epidemic has the potential to impact everyone. So we're not focusing on just serve these 200 people who overdosed in the last year. We're not only focusing on that, we're focusing more broadly.
And I respect that, and we want to try and capture everyone we can. But I also believe that from a priority perspective, we would want to say, okay, in the age group of 16 to 22, we've got a majority of the cases that we actually encounter are that age group. And of that age group, the fatalities are, maybe 25 to 40. I mean, I guess I'm saying that we should have some sort of data to suggest, where to apply the resources to get the most benefit. And I'm sure you guys, if you have that information, that'd be great to have you present some of that to us to say, as part of our plan, we want to put these programs out here, but if we don't have a target audience or expected outcomes, then we don't know whether we're doing the right thing. And that goes back to a lot of the ways that we've actually approached opioid problems in the past, is that, yes, we know there's a problem, throw some Narcan at it, and hopefully we save lives. But I think a better approach would be to really have target audiences that we can actually spend more time, like the high school, 11th, 12th graders, maybe college. I don't know. I don't know what the data suggests, but I'd still like to see a program that's related both to the potential problem, the projected problems in their problem areas, and then some sort of effort to try to reduce that so we can go out and address an issue and then determine whether or not we're actually getting results that we're expecting from the programs. So that way we can tie the need, what we think the priority is, and then the results to what our investment is. I'd like to see that sometime, because I think that way we can show the public that we're using the money correctly. Does that make sense?
Yes, absolutely, Commissioner. And over the last year, the Advisory Council has been looking at that data, and in the resolution that you all passed, it does list some specific populations, and those were the highest risk populations, because we do need to narrow it. This is not a lot of money, and so we need to narrow it where the greatest need is. So that was part of the process, narrowing down who is at greatest risk, developing the intervention, and then measuring the intervention. One of the contracts that will be awarded, or recommended to you all for award is with an evaluator. And we are going to evaluate the effectiveness and create periodic reports because one of the guiding principles is transparency. I think another benefit of the city and the county working together is both the city and the county have agreed to collectively work together, have one evaluator that looks across all of the contracts. So when you all approved the resolution in the presentation, it talked about how much would be dedicated to evaluation, and the city council approved the same thing.
So yeah, as part of these presentations, as we're going through and measuring this, I'd like to see some data that's associated with our effort and, anticipated results, effort, and how successful we are. So we are dynamic enough to go ahead and change the programs and rethink the process if it's not working.
Absolutely, yes.
Thank
you, Commissioner.
Commissioner Sanchez?
Thank you. I know I wasn't here last week, so playing a little catch up. But I get the general idea of the pre-proposal community workshop, but if we're developing RFPs until October, why are we already having a workshop to tell people what the RFPs are? That doesn't make sense to me. Like, why are we? I agree with trying to get information out so that we can help people be able to get funding and access it, so we do it. But if the RFPs haven't been developed yet, why are we already having a pre-proposal community workshop?
Commissioner Sanchez, the scope of work for the RFP are in development, and we will have the majority of the scope of work developed by September 16th. We already have the highlights. We know the 8 goals, and so we know the topic areas, which allowed us to confirm with the speakers for this workshop. The RFP process takes more time than just drafting that scope of work piece. We have to do the evaluation criteria. It has to go through several different approvals through city and county. So from the 16th through the end of September, we'll be doing all the technical part of the RFP. But after the approval of the resolution, that gave us the direction. So it gave us the speakers to invite and the topics for that workshop.
So the city is developed, so the RFPs are being developed through the approval of the city, but yet some of those areas aren't even pertaining to the city. So why, I guess my question is why is the city being involved with some of this? And like I said, excuse me for not being, not having been here last week, but my biggest concern is this, is that when we had the joint sessions with the city, my concern is very much the city was concerned about the city and had very little to care about the outlying areas of the county. I want to make sure that we are focused on the outlying areas of the county, and if the city's RFP process or any of that becomes a hindrance to services we want to provide in the unincorporated areas, are we looking at that and trying to get their review or approval? Because that's my biggest concern is the city's going to focus on the city. They have no, as much as I respect the city and my colleagues at the city, they don't have any skin in the game outside of the city. And maybe that's wrong for me to say, but I did not feel like that ever came across to me, because once you get outside of the city limits, they're not on the hook anymore. So how are we making sure that our RFPs are developed such that we're not going to be a hindrance to providers in the unincorporated areas?
Commissioner Sanchez, let me try to understand and respond, and if I'm not on point, let me know. So the 2 documents, one that will be released by the city and one by the county, they will each follow our own procurement process. We're trying to time it so it's at the same time and it's in coordination. So it's easier for the providers, people that might respond, make it very clear. Here's what the county is looking for, here's what the city is looking for, because it's going to be the same, most likely it's going to be the same providers that are responding to both. And we don't want duplication or overlap unless it's intentional. And one example that we talked through with staff at the county and the city is, we know that the emergency departments are all located within the city, but we know that those emergency departments serve people countywide. So, for instance, if we just did this out, we played this out as an example, so it's very theoretical, but if we were to fund services in the emergency department to focus on people who come in with a near overdose or withdrawal symptoms, so we know we're focusing on the population that is at risk. If the contract is with the city, the emergency departments aren't going to say, we'll serve you because your zip code is in the city, we won't serve you because your zip code is in the county. We're not even sure if emergency departments at the time of service delivery are able to do that and put you in two different buckets. So the city determined that their funding, because it is not gross receipts, it is not related to anything within the geographic area of the city, they can use their funding for people outside of the city. I know they may not want to, but we're not creating a, you go in the county bucket and you go in the city bucket. There can be services for anyone who comes into the emergency department. So the city, their attorney and internal staff said they do not have to be as rigid with their funding, with this funding, as they do with other funding. So that is helpful. But we may still want to find a way to say at the end of the year, 50% of the people that came into the emergency department were county, 50% were city, so each of us will fund 50% of that project. Those are the things that we have to work out with the individuals as part of contract negotiations. But they did, we asked that question, and this funding is different than other funding, so for the city, it does not necessarily have to go just to people who live within the city limits. So that gives us a little flexibility.
Thank you. And I understand, and I think, when I'm looking at, when I looked at the goals of this, one, I guess you could say 2 items of this is for emergency care. The rest of this is trying to really reach out to our populations. So that's why I'm saying, like, we're talking about the stuff in the city of Las Cruces, and I know that's half of the population of the county that don't, I'm not saying we don't work with our partners at the city. I just feel like when 2 of the 9 goals are focused on an emergency, but the rest, 7 of the 9, are focused on how do we identify people and reach people, get them access to medicine, get them treatment, get them, et cetera, et cetera. I guess my real concern is that I want to make sure, and we'll see as we go along how this plays out, but I just want to make sure that the people in the county, and then the same thing, and not just in the county, but the city of Anthony, Sunland Park, and Mesilla, and Hatch, they're not receiving the funds, and so, I want to make sure that those populations have access to that, and we're focused on that. And that's why I want to make sure that, understanding where it makes sense with the city, I just want to make sure that the city doesn't hinder us. The last question I had was, in terms of an evaluator, what is this evaluator going to do? I guess they're going to look at data and say things are working or not working. And is it like a person? Is it a group that's going to be analyzing this? What is this evaluator going to do? Or who's going to make them up? I guess, can you explain that a little bit more of that process?
Yes, Commissioner Sanchez, the county put out an RFP for evaluation services, and we're in the process of reviewing. I think we received 12 proposals. It's a combination of organizations like large university groups or individual evaluators. So we are going through that process, and the evaluators will first help us establish the type of data that we want to collect based on what are our key performance indicators, what are our kind of not research questions, but what do we want to accomplish. They will collect the baseline data, they will create the tools for gathering the information, they will analyze it, and then they will put it in a report back to us here and the providers, so we can do that continuous quality improvement.
And when you say the continuous part, how often will they be evaluating that data?
I don't have a
Or milestones?
frequency right now. I think it would depend on each individual type of program, but what we can set up, what you all can set up, is how frequently do you want these reports back to you? And initially, the reports might just be output measures, number of people served, and then sometimes it takes 6 months or a year to get the outcome measures and actually document changes.
And I think what I'm looking at or considering would be is, when we look at the RFPs and any contracts awarded, that, we have the information such that, this is something I'll have to rely on people much smarter than me with experience in this. But I would think, if we're going through and we have data that seems to indicate that some things are successful, some things are not, we can figure out, do we need to, put maybe we as the BOCC have to put more monies into the things that aren't as successful, or do we need to change strategy? I guess that's the one thing I'm hoping we can do. But I would assume that all contracts are probably going to be 1-year contracts with potential renewals after, but they'd give us the data. We would have time to evaluate whether or not we want to continue on with where we're at that point, is I guess what I'm hoping to do.
Absolutely. And on page 6 or slide number 6, the planning process, and it's not just the planning process, because once we're done with the planning process, that would be titled implementation process. So we've identified we did the initial needs assessment, we identified the core abatement strategies, we've now finalizing the specific activities, what do we want to address, and the next part will be these logic models. Some of that will be part of the RFP, a lot of that will be part of the proposals that we receive back. And then you see the next one, how will we know our efforts are working? And once we determine that, the next place is another needs assessment, and then going back to the core abatement strategies. Are we focused on the right things? Do we need to change that? So we can decide if we are on track with the timeline, and these are awarded in January. I think we should come back to you, every month, every 2 months with just a status report. But when we're focusing on this monitoring and evaluation, maybe there is an immediate 6-month report back. Again, it might just be counting number ofs at 6 months, and then at the end of the year, so we know, are we going to renew or not renew for that second year. Okay. But it is built into this process, is coming back to look at what's going on. We do have to give some time, put some money out there, and give some time to see if things are working.
Okay. Thank you.
Thank you, Mr. Thank you. Anyone else? No? Okay. Thank you, Jamie.
Thank you very much.
Thanks, Jamie.
This has got a lot to do,
Yeah.
and we got to make sure and use the money wisely. That's it.
Okay, next up is item number 3, the reappraisal process update. Welcome, Madam Assessor.
Good morning, Chair Shelja Hernandez, Commissioners Reynolds and Sanchez, Gina Eugenia Montoya Ortega, Assessor here at Doña County, along with Ms. Janice Madrid, who is our Residential Appraiser Supervisor. Normally, Ms. Tanja Hazen would have been here, but she had a doctor's appointment last minute, so she was unable to attend. As far as an update, there's kind of really no update. I went ahead and I brought Ms. Madrid in because technically, as I had said in the past, a reappraisal project would fall under the appraisal department, which would be Chief Ms. Tanja Hazen as or Ms. Madrid. So I'll just go ahead and let her kind of give an update.
Good morning, everyone. As Gina just stated, there's no update yet. Me and Tanja have been trying to discuss the possibilities of doing it internally as they kind of broached last work session. Right now, we are in the process of just getting our staff fully staffed. With that, even when it is fully staffed, we're still gonna have to bring on new people. There's no way that our staff alone can handle the reappraisal as they discussed last time. I think about like 14 term positions were done back in 2010 and 11. So me and her have been discussing how we could do that because the workload is actually significantly higher than it was more than, 15 years ago. Our workload is, we currently have 6 actual appraisers when we should have 7. So we are hiring for the 7th one soon. We are supposed to have 7 appraisers, assistants, one for each appraiser. And right now we have 3. So those are posted. And in the commercial department, they should have 2 other full appraisers and there's only 1. And so that's working on being posted too, but that one's for lack of applicants. People just don't apply to that position. So the appraisal staff alone is just not fully staffed to handle that yet, but also with the influx of all the new construction going on, we really can't use our full-time staff to handle a reappraisal job. That's why Tanja was looking more into hiring an outside resource. But she is trying to put together a plan and then working through looking for those outside assistants. And so right now, I don't have any more information than that.
And then, sorry, also, so Ms. Madrid was actually one of the people that was brought in temporarily to do that reappraisal project that they did in 2011. So that's how she started here in the office.
Awesome. Well, thank you for joining us. Thank you for that information. Commissioners, any questions?
Since you're both me, I assume you want me to ask something. So
I mean, someone needs to kick it off, Commissioner Reynolds.
Okay, a couple things. What are the challenge of, like, are you required to have the update finished by the end of this year, by the end of next year? Is there a time limit on that, number one? And number two, is there any way we can get caught up with the appraisals? I mean, what's the plan to do that?
So I guess clarification for me, are you discussing getting caught up to do a reappraisal or getting caught up on our current workload?
Well, I mean, the challenge here is reappraisals, right?
Okay.
And so if the real challenge is reappraisals, I mean, what would be the timeline and the plan and the resources really required? Because right now you're saying we don't have enough staff, we're not hired enough, we're not fully staffed. So what do we specifically need to do, and what kind of timeline are we running on to get this done?
The timeline for the plan, I would assume, wouldn't really be worked until probably the end of October. Right now, we're currently still doing a bunch of the non-residential commercial protests. So that's where a lot of time between me, the commercial supervisor, and the chief appraiser, Tanja, have been having our primary focus.
So how many commercial challenges do you still have on the table?
I'm sorry?
How many commercial challenges do you still have you're dealing with?
The protests,
Protests, sorry.
yeah, we don't have a final number what we're dealing with still. We're still currently working them. There was, let me think for a second, about 330 commercial protests filed, but there was also 500 some, I think, for vacant land protests, and that's what we're currently working on at the moment.
So how far are we in that list? That's 800. How many have you been able to get off the table?
That I'm unsure. I don't know how many have been withdrawn yet.
I guess what the best question I can ask is, if we have 800 protests and we've got how many reappraisal properties need to be done? 5,000, 2,000, 100?
The whole county consists of over 11,000 parcels.
Do we have to reappraise all of them?
No, well, I really did like Commissioner Hernandez's idea last time of everything that we've recently touched, we wouldn't obviously need to relook at. So a bunch of like our new construction wouldn't need to be revisited. Last year for 2024, we had, I'm doing some quick math in my head, over 1,000 newly constructed residences. So I mean, that can take off the workload also. Anything that, like we discussed, anything that's had recent permits from 23, maybe even 24 for sure. Anything we're currently looking in 25, but overall, we would still need at least maybe 10 people to come on, and in our office, there's no space to even house 10 people or have vehicles for them to utilize to go to the job sites.
Okay, so there's some challenges right there. You know, I guess there's a saying that I remember from a long time ago that I used occasionally, and that is it's hard to remember when you're up to your butt in alligators that your purpose was to drain the swamp. And that's where you guys are kind of at. It's like, until you've got so much on your plate, I think the first thing we'd like to hear, and I think you probably want to do, is to actually scope the challenge. Basically, if you've got 11,000 properties, determine how many you don't need to do, you know, put those on a board someplace. And then the same thing about the challenges, okay, that are basically commercial. And just basically, I'm kind of, I guess, organizing the challenge. Because from what I'm hearing, it sounds like you got a swamp full of alligators, but you can't drain the swamp because you can't get the alligators off your back. Is the problem. And I think if I were looking at it, I'd probably want to take the approach just to basically scale the project. And like you said, trucks or vehicles, location. Have you looked at a place that we could house some people? And is there, I mean, we've got the facility that we, down the road here, I know that we're using part of that. I don't know if we're using all of it. The one next to the restaurant, are we using all that space, or is there more space left?
I don't know.
Anybody know?
Question.
Okay, I guess what I would recommend, and I think what we need to hear at the board is, I mean, we can't call it an impossible task. So if it's not an impossible task, then we've got to figure out what the scope of the project is and what kind of help you guys need. And then with that, is it financing? Is it maybe we get HR to help you hire people? Maybe we get an outside source to do recruiting for you. Maybe we have a property manager, Robert, try to find locations for people. And then we have Gabe try to find more vehicles. But I guess we got to scope the project first and get some sort of idea of what we're dealing with. And until we have that, I don't think in direction from you guys, I don't know what the board can do to help. Except to say, and I guess the real challenge here is, as a county, what kind of risk do we have by not getting up on all this stuff and getting it done? I mean, I know there's money, but is the state going to come down on us and say, you know, how come you're so far behind? I mean, can we get fined? Can we get fired? I mean, what are the consequences of risk? I mean, these are things I don't know. That's why I'm asking. I mean, what's the risk if we don't get this done to the county?
Well, over the last year in 2024, I had our assistants that we had doing what I called like a cleanup project. So they were correcting all of our data for the appraisers that they helped in the area. And with that, they would look at aerials or go do field inspections and things of that nature. So it's not that we haven't really touched anything since back at the previous reappraisal. It's just that, like you're stating, we do need to really organize what has been worked and what still needs to be worked and then tally those numbers.
Do we need to hire some temporary staff to help you guys out, just to scope the project? I mean, maybe that's what we ought to do, is go to Robert Half and say, we need somebody to come in and just to basically organize our problem.
I think, at least in my own position, once my staff is fully hired and I'm not picking up those extra duties, or like commercial also, then I think, you know, between Tanja also doing extra, I think me and her and the other supervisor could really work through this. Like I said, we are currently going to be scheduling for the last appraiser position. They have already applied and we already have the pool. So that should be done within the next few weeks. The appraiser assistants are posted or being posted, as well as that commercial position.
When's the last time you were
This is
fully
minor.
staffed?
I'm sorry,
When's the last time, you've been here, what, 5 years, 10 years,
almost 14.
14? In the last 14 years, how often has your office been fully staffed?
Pre-COVID, I would say.
I'm sorry?
Pre-COVID?
Yeah, pre-COVID. Well, anytime, but
Well, I mean, it was before COVID that we were fully
COVID.
staffed. Yeah, there's always an influx of rotation through there, especially in the appraisal department, because people who start off as assistants end up climbing the ranks to like appraisers, so then we're always kind of like refilling from that.
are we losing people because we're not paying enough? Are we losing people because there's not enough qualified people? Should we be creating a program to actually train other staff, okay, to become appraisers? I mean, give me some idea what we can do to help fix the problem.
I do think that the pay is an issue. That's one of the reasons why commercial can't get anybody even as an applicant. They maybe get one applicant. I know she's tried for years and years and years, and so they are working with HR on that situation. But even for appraiser, even assistants with constantly being out in the field and the workloads that we actually do have, I do feel that a pay increase would be helpful. Because there are a lot of times, appraiser assistants, like I said, do like to rise up and become appraisers most of the time, but some of them don't want to take on the extra responsibility for a very minimal pay increase, which is the same for the current appraisers. They also don't like to apply for the commercial position either, even within the office, because they don't want to take that extra responsibility for the very minimal pay increase. So it is really hard to get that type of appraisal staff in. And honestly, for me being the person who trains, I wouldn't really want just a temporary somebody to come in and have to give them all of that appraisal type knowledge for just a short period of time.
Okay, I guess this goes back to Scott and HR to help us understand how it's working or not working to either hire more people, raise the pay, or find temporary staff to help us out. I'd like to, I guess you guys are you working, if you're working closely with HR right now, maybe we should get a report from both you and HR about what the solution is and what the board can do to help. Okay? Does this sound fair?
Well, I'd say Commissioner Reynolds, I think that's just one piece of what we're hearing. I think going back to what you said, if we don't have anything that the timeline, what the needs are, what the urgency is, any of that, we have no way to know how we can support you. Is it HR? I think as Commissioner Reynolds said, is it the fleet that we need to work with on vehicles? Is it, I mean, there's so many, I've heard, I've heard several things that it seems like there's asks, but until it's like something we can see, and then, then we can direct or ask Scott and the team to go and help support. It's, all we're doing is playing whack-a-mole at the moment. Okay, it's HR, but what's the next one? And then what's the next one? And then if we had a plan, then we know, okay, let's talk on here's the support you need from all these different departments. Let's work together to try to figure that out. I think that's where I'm looking at is, I think if we could develop a plan that says this is what we need, this is the support we need, I think the BOCC can work in trying to give that direction to management. I haven't seen it yet. And if we know kind of deadlines that you're trying to work on, that helps us too, because it's like, okay, the urgency is we need this first, and this first, and then we can go and get those and help you get those things. That's where I'm at. I guess I'm just asking for, I think as Commissioner Reynolds is saying, if we have that plan or the requests and deadlines of what you're trying to meet, that would make it so much easier for us, so we know, we don't have to keep asking one by one of.
Well, I think ultimately, I mean, we do need to get our current staffing load complete. That's the first step of anything, because, I mean, if I'm still doing other tasks and also needing to train a whole new reappraisal staff, I mean, how am I supposed to accomplish that myself? But like I mentioned before, having my staff fully staffed, then I know, and trained, then I know they can go off and do their thing, and then I can handle, training a reappraisal team. Or vice versa, if we end up going with an outside source, whatever the case may be. But I think that's the first step that needs to be done, because I know that in the past, last session, you guys were talking about, oh, there's supposed to be 52 people in the appraiser's office or whatever the number is, and there's like 30. I mean, all those 52, even if fully staffed, they're not going to be going out and doing appraisal like I was mentioning. It's just going to be my staff. It's not going to be title or GIS or front office or data entry, the people who enter all the work that we bring in. So, I mean, I think those need to be fully done too, because right now we are also recently missing some of the data entry. So even if we had people bringing in all this data, who's going to enter it? So I think ultimately my biggest concern is getting our current staff fixated and done, and then we can focus on the next step of reappraisal. But that's also why I feel that, you know, a plan hasn't been done yet, because like I stated, we're all kind of pulled everywhere right now.
May I jump in real fast? Board?
Of course.
So I will own the last 2 weeks. I know we wanted to get together and do that, and that didn't happen between the weekend, the holiday, and just the historic agenda last time. So I'll absolutely own that. Speaking for the board, maybe, I think not having a full board here is having this go a little better than it might have, and everyone coming off a 3-day weekend. And again, this is not directed at all personally, Janice or Gina. I think we just need a plan. I don't know how that last meeting went with HR, but I know off the top of my head, none of your areas were ones that jumped off the page as outliers above or below. I'm looking at Deb to see if, yeah, I think that's correct. Under this current board, we have got to get this reappraisal done by kind of any means necessary. And I saw your face when the question was asked if the state would step in, and I think they will at some point if we don't get our act together. So let's sit down, let's look at a game plan. I know budget team's not here today either, so that would be helpful to have Lucio or Eric here in this conversation. But we really got to figure out a way. I appreciate you all being, talking through everything today to fully understand what we're up against from a staffing perspective, but I also knows this goes way back over a decade at this point. So the things we've done in the last 2, 3, 4, 10 weeks at this point is just a drop in the bucket. So I humbly ask if we can just have a big team meeting and you and I can work through it, Gina, and bring everyone to the table and really do what we probably should have done prior to today. So right now I see some eye-opening here, but also humbly please understand from staff perspective that maybe they're not asking the right questions, and maybe everyone's still thinking about their long weekend we just had, but I think we're still not in a good place overall.
And I can put together the numbers to definitely show you guys what we have done recently and like what we need to look for in the future. And I know Tanja was already kind of working that because she had stated, we would need X amount of people to do X amount of counts a day. So I know that she has most of that information, and unfortunately, like we said, she had an emergency and couldn't be here today. But I can pull everything that we've done recently and get that to you guys within the week.
Mr. Chair?
But I don't know, like you're stating what else information you want, if you're wanting like the full out plan or just wondering where our current work is. Our current workload is we are staying on top of that. We're not getting behind on anything, but it is a lot for everybody to, pull through and complete.
This is a quick question.
Of course.
Does anybody, what is let's say the state comes in and takes over. I mean, what kind of impact is that going to, for first thing, what kind of impact is it going to have? And secondly, are they going to be able to do it? And how can they do something we are not able to do? I mean, can they? What happens there? Because it sounds to me like we got a runaway train in some cases and no idea about how to stop it. And so what's the risk for the county if the state takes over?
Commissioner Reynolds, that is a possibility. That's what happened. I believe it was in Grant County. So the state could, PTD could come in and take over the assessor's office. And at that point, it's out of our hands. It's out of your hands. They're going to do what needs to be done to make sure that reappraisal does happen.
And they're going to bill us for it?
Yes. And so that goes back to that 1% that I kept talking about. There is the PTD does have a fund for like the smaller counties that can't they cannot afford to do the reappraisal. But that ultimately, they'll pay for it, but the county has to pay it back. That doesn't apply to a county as big as ours, where we should have that 1% to be able to do the reappraisal, that we would qualify to, have them loan us the money, and then we'd have to pay it back. Because they are going to turn around and look at that 1% to see what happened with that 1%.
Okay. And are we getting close to being at risk of that?
Commissioner Reynolds, with the way PTD's doing things, back in the day, probably, this would have happened after, the first year that I brought it to the commission. Now, whatever PTD's doing, it's totally different, the way they're kind of doing things, so I have no idea.
Thank you.
So is it at all possible to have something by the end of this week that at least gets us what needs, what support you need, any of that? Like I
For
said,
overall or for the full reappraisal?
For the,
I mean, we kind of broached a lot of topics here, so I just want to make sure I understand.
I think both,
Yeah.
but at least getting to the halfway point of the reappraisal, I know this is going to be a multi-year project no matter what, so let's get maybe a 2-year and a 4-year plan looking at, and obviously the immediate needs for your area as well. Sorry, board, I jumped in there, I apologize.
yeah, I'm just trying to, like I said, I think, like I said, if we have something, I don't want it to go to the point that the state has to come in and take over. I want to be, I think, I can't speak for the rest of the BOCC, but I think we all want to be supportive of this. We just need to know how we can be supported. That, like I said, I think I go back to that. If we have a plan, or at least asks or support what you need, priorities, that helps us at least be able to communicate with management to try and get you that support. So, without that, we're kind of, we don't know how to support you all, other than to ask, like, okay, what's going on? But, like I said, if we have that plan, it definitely helps us to know what support you need, so we can try to get that, so we can get going on that, on a road for recovery.
cool. We'll expect some progression on this then. Thank you.
Thank you.
Thanks, Janice. Thank you.
And that concludes our work session today. It's 10:07 and we're finished. Thank you, everyone.